So what do you think about as far as like, I mean, when somebody's older, they know you can talk to them about what it's going to be like to go to the doctor. But when it's the difference between a well visit and a sick visit, and I think it's really important, by the way, to keep the big picture, because what I always worry about is if every single time, if they're sick or they're well, they're getting shots or they're getting things that happen, different procedures that happen to them. I'm always worried my kids are going to start to associate the pediatrician with bad things and a negative situation.
Right. And unfortunately, that does happen sometimes. I mean, there are some children who do end up with chronic illnesses and they have to go to the physician over and over again for medical
treatment. Even when they're well, they have to get shots.
And they have to get shots, correct. And they do realize that there is a pattern. They come in.
Ooh, I see this building.
Right, the white coat, things like that. So as pediatricians with children, we try to make it more of a pleasant experience and as a, sort of a fun environment.
It's time for us to take our break, so come back with us in a moment. We'll have more with Dr. Acey and Dr. Ober.
Do you know that stroke targets by color? If you're African American, you're twice as likely to suffer a stroke as white Americans. Join the power to end stroke at strokeassociation.org.
If a natural disaster happened, we'd probably all meet around the grocery store.
We would all meet at a bus stop.
Oh, we'd probably meet at our neighbor's house.
Welcome back to It's Feeling Groovy with Dr. Acey. Let's hear more from Dr. Ober and Dr. Acey now.
Thanks, Barbara. We've been talking a lot about ways to take control of our bodies and medical well-being and communicate with doctors. And I have been wondering this for a long time. I know what it's like when my patients come into the office and have looked online and self-diagnosed, and it's hard to know what's real and what's not. How do you feel about what the internet has done to the medical profession?
Well, that's an excellent question. The internet has done wonderful things for the medical profession.
Okay.
There's a lot of information out there for people to find, so they can research a lot of things. If you are diagnosed with an illness, for example, there's a lot of websites set up by organizations. For example, if you have Crohn's disease, if you have food allergies,
well, what are some
like
of the good ones? Because I know that there's a lot of information out there that if people just search can be scary. What, in your opinion, what are the ones to go to?
Well, there are lots of them. I mean, for example, the American Academy of Pediatrics has a website with a lot of links for parents that will give you information.
Hey, Barb, can we get that on our website?
Yes, I'm actually writing that down now.
Yay. Thank you.
American Academy of Pediatrics.
Right.
Fantastic.
So for parents with young children, it talks about development, immunizations, which is a very hot topic right now.
It is.
It talks about any hot topic that's out there. So H1N1, when we had the big H1N1 scare last year, that was out there. Flu shots, anything seasonal that's coming up.
So that's one you
ear
trust.
infections, correct, yes. It talks about anything having to do with children. There's resources for books to buy on there. There's references to other websites, such as the Mayo Clinic, which has a very big website that talks about all different kinds of things, diseases and things like that.
Well, what do you think about people who just, type in a few symptoms and decide they have, do you think it's important to talk to the doctor and prep them ahead of time before you bring in the kid? Do you think it's important to bring, I think it gets really tricky when people come in with this whole list of stuff and it's hard to know, is this someone who's, just gone online, or is this someone who has a medical background, or?
It does, and you can definitely tell sometimes if somebody's been online, just the way that they're talking. They will approach things and throw out some medical jargon, and you can find things in kind of a jumbled manner. And so sometimes I'll just ask people, have you been looking online, and ask where they're looking. And when you ask people, if they are just putting things into Google or Bing and just kind of blogging things and reading other people's blogs, then it can make a big mess, because people will type in their opinions or their personal stories, and things can get very scary because you're only hearing sometimes the worst nightmare story, the 1 in a million kind of story, and you don't get the story of what happens 99.9% of the time.
But what about the person who's right?
Well, that happens sometimes, and that is why I think it's most important, if you are looking at something on the internet, you suspect something is wrong, you need to make an appointment and discuss things with your physician. Tell them what is happening. Tell them about your symptoms. Tell them about your concerns. Don't hide something. Don't wait for the physician to drag things out of you and expect them to know exactly what you're thinking, because nobody can ever know what you're thinking. If you are suspecting something, spill it out there.
Well, I mean, I guess I'm one that always thinks that, you know, having a companion, like somebody else as a witness, you know, to agree with that this is symptoms that are happening. What do you think about people bringing a companion to doctor's appointments?
I think it has its positives and its negatives. I mean, I definitely think there are some appointments where you need some privacy. Depending on the issue and what you're talking about, you may need some privacy. And so there are circumstances where there may come a point where the physician may say, do you mind if we have you step out of the room? Or are you comfortable talking in front of your friend, your husband, your relative, whoever may be with you?
Sure.
I definitely think in the circumstance where you know that you're discussing a serious illness or a chronic illness,
Right.
it is a good idea to have somebody with you, because all of that information comes rushing to you.
Right.
It's very overwhelming. You're not going to absorb it. And so it's a good idea also to write things down. That's the most important thing. Write them down, have somebody with you, because those circumstances can just be a lot to take in.
Do you think that, I mean, one of the questions I had a client this week that was talking to me about how he's been very ill, and he brought his fiance with him to a doctor's appointment because he thought, I just don't feel up to this. I need her to help me ask these questions, write these things down. He said that she was so aggressive with the doctor that he thought that the doctor didn't believe some of the symptoms that he was really going through, and actually didn't want to run some of the tests and didn't want to really work with them that much. So it's kind of a reality. How do we not make doctors feel so defensive?
Right. Well, I mean, it's hard as a physician to remember that you need to be professional all of the time, but you do. You have to be professional, but you do have a human side, so you can be put off sometimes, but you must always be professional. If the signs and symptoms are there, you need to always follow the pathway and go with the tests and the exams that you need to do.
But maybe if you're going to bring someone with you, bring somebody that you know can be neutral.
Right. And you may not know until you get into the office what that person is going to react like. So if you bring that person with you and they're a little aggressive, a little standoffish, and you get that feeling, maybe that's not the person to bring with you the next time for sure. But if you want someone there for comfort, for companionship, for assistance, you should definitely bring someone there. Nobody's ever going to tell you no. And if they do tell you no, maybe it's not a good fit for you.
Well, what about when you've got a kid, I mean, who has certain characteristics? Do you think that it's important for the parent to prep the doctor? I mean, I know that it's, you know, that can be off-putting, and it's like, no, you don't have to tell me all that, I know, or ahead of time. What's that?
You can if you want to. I mean, you have to remember that we've seen all kinds of people in all different circumstances, stressful circumstances, coming to the physician, especially as a kid if you need to get shots or if you need to get a finger poke, put you not in the best light all of the time, and you're not always on your best behavior, and it's a scary experience. And even if the last visit was the visit where you got your shots, and then now you're just coming in because you have a sore throat or you need to get you know, a stitch or something like that, this time can be super scary as well because you remember the last visit. So you can say, you know, to the physician, he's a little off today, or he's a little whiny today, something like that, and you know, we'll take it, you know, into the back of our head.
Don't use the word poke, use the word,
yeah, that scares them, and that's, for you know, definitely helpful sometimes. But we also know and have our ways of getting around things, and one of the things that I always do when I'm talking to parents is use the word immunization, because most little kids don't know what that word means.
Shot.
But shot, they know. Poke, they know. So there's ways of kind of getting around it and discussing things with parents when they're real little.
Well,
so
you're good at this.
we have little tricks of the trade that we use.
You know, something I've always wondered is if somebody has a theory or wants a certain test run on themselves or their kid, something checked out, and they say to the doctor, I want to be checked out for this. What's the doctor's responsibility to follow through on that, even if you don't, maybe you don't think that was really what's going on? I mean, where's that line?
Yeah, that's another great question. Again, there are certain things that are not super harmful to do. If you have a family history of high cholesterol, diabetes, thyroid, hypothyroidism, and you have a child that you're considered or a little concerned about because maybe they're a little overweight or they're having some symptoms, to say that you want that test done, even though the physician maybe hadn't suggested it, those circumstances might point to doing the test. But if you're asking for CT scans, X-rays, MRIs, things like that, and they're not warranted, and their cost is just so so high, then that is something that would not be necessary to be done. The physician's most likely going to say no, and I would hope that they would say no because they're not needed. In the circumstance where they are needed, they will be ordered.
Well, but it gets tricky because at the same time, we always hear these stories about where that we have a litigious society. And if someone says, I think this is what's going on,
Right.
is there pressure to
Sometimes.
rule that out? Just
There sometimes is pressure. I mean, there definitely are people who ask for things and they want certain tests. But if the symptoms and the circumstances do not warrant the test, and you're asking for very expensive, very invasive tests, then they don't need to be done. And it's the job of the physician to really explain why and what needs to be done and what does not need to be done and why, and what the costs and the benefits are of doing each individual thing.
I think that makes a lot of sense. Barb, did you have, when your kids were younger, did you have to go through any diagnostic testing with them? And
No, fortunately, I have very healthy little children, but on the other hand, extreme opposite, I do have elderly parents, and we, have a lot of questions and stuff like that, and we do like to go to the doctor with my parents because I don't always feel like my parents are understanding or hearing. Sometimes they hear more than what they need to hear, and sometimes they're not hearing enough. It goes both ways. Like sometimes they come home panicked, and it's like, well, that's not really what they said.
I'm so glad you said that, because I think that would be a whole another show topic that would be so helpful, because with people living longer now and this generation of people taking care of, I have grandparents that I've helped take care of, and it's a whole new it's a whole new system, and people don't know what they're doing because people didn't live this long, and there aren't the same things that have gone on in years past. So you're absolutely right.
Yeah, people are living much longer, and we're seeing different health problems that we didn't see before. And
I mean, you've had some of that in your own family. So I mean, you can appreciate how that maybe bringing someone to those appointments is a better, maybe even more important than to a pediatric.
yeah, I would absolutely agree with that.
All right. Well, I mean, do you have any advice for people when they are, I guess, trying, I guess the last thing would be, just one last piece of advice for if someone is going to go out and try to talk to their pediatrician about something, what would be the number one piece of advice that you'd want to give them?
I guess the number one piece of advice that I would have is to remember that your pediatrician is there to help you, and they want to have a good relationship with you. So just try to be open and have good contact. And
yeah, I think that's good. Everyone's in this for the right reasons, to feel groovy, and hopefully some of the information we've shared today will be helpful for some of you. I would love to hear some of the questions that you have. Feel free to write into our website, and hopefully you'll join us again for our next show of Feeling Groovy with Dr. Acey. Thanks for being here.